Welcome to Paals. It's Prof Anyanwu's Anatomy Lecture Series. If you are watching our video for the first time or you have not subscribed, we please encourage you to do so and be part of this great, amazing anatomy family where we make anatomy simple. So in today's lecture, we'll be considering the last part of our series on brainstem. We did Part 1. In Part 1, we considered the general features of brainstem and also the external feature of medulla. In Part 2, we looked at the internal features of medulla and related clinical anatomy. In Part 3, we looked at the internal and external features of the pons. And in this Part 4 you're watching, we are going to consider the internal and external features of the midbrain. So, let's go to class. We will start with the external features of the midbrain. This is the part of the brainstem that connects the pons and cerebellum to the forebrain. Let's look at our first image. This part is the part that is called the midbrain. That's the midbrain. Now, in this midbrain, it connects to the cerebrum through this structure called the cross cerebri. Now, this midbrain has a cavity that is called the cerebral aqueduct. We're going to use our next image to have a good look at the cerebral aqueduct. Here is the sagittal section of the brain, and this part is the midbrain. And this cavity here is a cavity of the midbrain that is called the cerebral aqueduct or aqueduct of Sylvius. Now, just as we noted in our general introduction on brainstem, we talked about how this cerebral aqueduct connected the third ventricle here with the fourth ventricle here. Now, cerebral aqueduct divided the midbrain into two parts. We have a large anterior part that is called the cerebral peduncle, and we have the small dorsal part. So cerebral aqueduct divides the midbrain into two parts, anterior part and a posterior part. I also want to look at another division of the midbrain. We are going to revert back to our first image, and here we are seeing those two structures that connected to the cerebrum, and that's the right cross cerebri and the left cross cerebri. So the midbrain is also divided into two halves, the right half and the left half. At the center here is the fossa called the interpeduncular fossa. We're going to have other images that will give us a better view. Now we are going to consider the anterior surface of the midbrain. In this anterior surface, we are seeing the right cross cerebri and the left cross cerebri. And in between them, we are seeing the interpeduncular space or interpeduncular fossa. That's a space we can see here. And inside the interpeduncular fossa, within its floor is the area perforated by blood vessels called posterior perforated substance. That is the region I am pointing the light. We see some cranial nerves around the midbrain. The first one of interest is the third cranial nerve. This is the third cranial nerve, one on the right and one on the left. So this nerve will emerge from the interpeduncular fossa. The next cranial nerve that's of interest is cranial nerve 4, that is the trochlear nerve. Now, trochlear nerve will exit the midbrain from the posterior aspect and then will circle from the posterior aspect, as we can see here, and then take a curve towards the anterior part, circling around the cross cerebri. Now we look at the posterior surface of the midbrain. The posterior surface of the midbrain is marked by 4 rounded swellings that are called colliculi. We're going to take our first image here. In this image, we can see the 4 colliculi. We can see the 2 sets above and we can see the 2 sets below. So we have 2 sets. The set above called the superior colliculi and the set below called inferior colliculi. Now each colliculus is related laterally to a ridge that is called the brachium. Also in this image, we see the superior colliculus and the inferior colliculus, and we also see the brachium. So we have two. We have the superior brachium and we have the inferior brachium. Now the superior brachium connects the superior colliculus to the lateral geniculate body. Inferior brachium here will also connect the inferior colliculus to the medial geniculate body. These bodies, both the lateral geniculate body and medial geniculate bodies, are all expansions and swellings around the thalamus. So another structure that is of interest we should note at this point is the membrane below the colliculus. Here in this image, this is also a sagittal section. We can see the 4th ventricle, and above the 4th ventricle is the lower aspect of the inferior colliculus. We have this membrane, superior medullary velum, that is located below the inferior colliculus. And this membrane stretches between the 2 superior cerebellar peduncles and helps to form the roof of the 4th ventricle. So this is the superior medullary velum, and then it stretches between the 2 superior cerebellar peduncles and then forms the roof of the 4th ventricle. Before we go to the internal features, we'll use these 2 images to have a brief summary of the structures we've mentioned so far. Now let's look at this anterior surface. In this anterior surface, we made mention of the cross cerebri, talked about the right, and then we talked about the left. And then we mentioned that in between them, we see the interpeduncular fossa. And then we said at the floor of the interpeduncular fossa, we see the floor perforated by small vessels, and we said that this area perforated by small vessel is called the posterior perforated substance. Now when we looked at the sagittal section, that is here, that's the sagittal section, we were able to pick out the cavity of the midbrain here, which we said is the cerebral aqueduct or aqueduct of Sylvius. And we said it divided the midbrain into 2 halves, the anterior half here, and then the posterior half is called tectum. And we said at this posterior half, we see 4 swellings, the superior colliculi and the inferior colliculi. And we also talked about the membrane that forms the roof of the 4th ventricle called the superior medullary velum. And clearly shown here are the 4th ventricle and the 3rd ventricle connected by the cerebral aqueduct. Now we are set to move to the internal features of the midbrain. A coronal plane passing through the aqueduct divides the midbrain into 2 parts. Let us identify them. Here is a transverse section of the midbrain, and this is a coronal section cutting across. This is the point of the cerebral aqueduct. So if we still remember the posterior small part, which is called the tectum, and the large anterior part, which we said is called the cerebral peduncle. Now the tectum is made up of the 4 colliculi. We've already mentioned them, while the cerebral peduncle can be divided into 3 parts. Now these are the 3 parts of cerebral peduncle. We have the part called tegmentum, we have the part called substantia nigra, and we have the part called cross cerebri. So let's identify them. Now the area here is called the tegmentum of the cerebral peduncle. while the outer area here is called the cross cerebri. Now we have this middle layer between the cross cerebri and the tegmentum here, the tegmentum. So this layer is the darkened area. This area is called the substantia nigra. So the tegmentum, the substantia nigra, and the cross cerebri will make up the cerebral peduncle. And we have two halves, the right cerebral peduncle and the left cerebral peduncle, with the interpeduncular fossa at the center. In discussing the internal feature of the midbrain, this study is done at two levels. Now, the structure in the tectum and tegmentum will vary at the different levels of the midbrain, while the cross cerebri and substantia nigra will nearly remain the same throughout the length of the midbrain. So we'll look at the two levels which the internal structure of the midbrain is studied. Now the two levels are, one at the level of the inferior colliculus and two at the level of the superior colliculus. The inferior colliculus is the lower level, while the superior colliculus is the higher level. We will start our study from the lower level, which is at the level of the inferior colliculus. Let's look at our image. In this image of the transverse section of the pons at the lower level, we are seeing this level at the level of the inferior colliculus, and here is the inferior colliculus that is giving us the landmark. Now look at the central gray matter first. Now this is the cerebral aqueduct of Sylvius. Surrounding it we see the gray matter. Now amongst the gray matter that are here, the one of most importance is the nucleus of trochlear nerve. Is the nucleus of trochlear nerve, and this is the nucleus of trochlear nerve. It is situated anteriorly. Then the next nucleus of importance is the mesencephalic nucleus of trigeminal nerve. Now this is where we have them. That's the mesencephalic nucleus of trigeminal nerve. The nucleus of trochlear nerve is located behind the medial longitudinal fasciculus. Now trochlear nerve is the only nerve out of the 12 cranial nerves that will exit through the back of the brainstem. So each of these nerves will move backwards and then towards the floor of the fourth ventricle. Before exiting, it will also decussate. It is also the only cranial nerve that decussated within the brainstem. After decussation in the superior medullary velum, it will exit from the posterior part of the midbrain. This is the point of exit from the posterior part. Apart from the nucleus of the fourth cranial nerve, the trochlear nerve, we have other nuclei of interest. We have the mesencephalic nucleus, inferior colliculus, substantia nigra, and we have reticular formation. Now, the mesencephalic nucleus will lie in the lateral edge of the central gray matter, and it will receive proprioceptive impulses from muscles of mastication and will contribute to the nuclei of the trigeminal nerve. The nucleus of inferior colliculus is formed by ovoid mass of gray matter that is seen under the inferior colliculus. Now, the substantia nigra is a band of gray matter that is located between the cross cerebri and the tegmentum. The reticular formation, although here in midbrain, is smaller than the size we see in the pons, is situated between the medial lemniscus and the central gray matter. We will also consider the white matter that we can see at this level. The first one we'll look at is the decussation of the superior cerebellar peduncle, which is seen here. Another of interest is the lemnisci that are arranged in a curved compact form, which are arranged in this form. And then also we'll look at the medial longitudinal fasciculus that is seen here, and the tectospinal tract that is seen anterior to it, and then we'll also see the rubrospinal tract. Now let's start with the decussation here. Now the decussation of the superior cerebellar peduncle occupies the central part of the tegmentum, and it forms the most important feature in the lower part of the midbrain. In the lemnisci, we are seeing all the 4 lemnisci. We are seeing the medial, the trigeminal, the spinal, and the lateral. The medial, the trigeminal, the spinal, and the lateral. For medial longitudinal fasciculus, we see it lying anterior to the 4th cranial nerve. And then we see the tectospinal tract also in front of it. The rubrospinal tract is seen before the decussation of the superior cerebellar peduncle. We will now consider the transverse section of the midbrain at the higher level. Let's look at our image. At this level, this is the level of the superior colliculus. This is the superior colliculus. The central gray matter at this level contains 2 nuclei. What are the nuclei? We'll start with, here is the cerebral aqueduct, this is the central gray matter, and here is the main nucleus of interest, and that is the nucleus of the 3rd cranial nerve, which is the oculomotor nucleus. Now behind it, still at the same level we saw it in the lower level, is the mesencephalic nucleus. Now the oculomotor nucleus here lies in the ventromedial part, and the 2 nuclei will fuse together, as we can see, the right and the left, and they will form a single complex having a triangular outline. Something also interesting concerning the relationship of the oculomotor nucleus and the medial longitudinal fasciculus. At this level, we can notice that the medial longitudinal fasciculus is now bound to the oculomotor nucleus. We also have other nuclei. We can notice that still part of this complex is a very interesting nucleus that has made oculomotor nerve very unique. So forming part of the component of this nucleus is the nucleus we call the Edinger-Westphal nucleus. This nucleus supplies the sphincter, pupillae, and ciliary muscle and forms part of the oculomotor nucleus. Oculomotor nerve will pass through the tegmentum as we are looking at it here. Both of them will pass through the tegmentum and now will run across another very important nucleus. Now this nucleus is called the red nucleus. The nerve will pass through the red nucleus and also run through the medial aspect of the substantia nigra and will eventually emerge in the space we've already noted called the interpeduncular fossa. Now back to the red nucleus. The red nucleus is a mass of gray matter which appears ovoid in a cross section. Now let's also go back to the superior colliculus. That's the superior colliculus. It's a flattened mass of white matter and also gray matter. And then we see the gray matter that forms the nucleus of this colliculus. We also have this other nuclei, the pretectal nucleus. This is the pretectal nucleus here, in front of the nucleus of superior colliculus. This nucleus receives afferents from the lateral root of the optic tract and will now pass it to the Edinger-Westphal nucleus. The nucleus forms part of the pathway for pupillary light reflex and consensual light reflex. If there is lesion of pretectal nucleus, it will cause what is called Argyll-Robertson pupil, where light reflex is lost, but accommodation reflex is intact. We will consider the white matter at this upper level. We will be seeing 2 decussations. One called the ventral tegmental decussation, that is here, where we saw the decussation of the superior cerebellar peduncle. Here at this upper level, we are seeing a different decussation called the ventral tegmental decussation. We also see another decussation at the back called the dorsal tegmental decussation. So dorsal tegmental decussation or decussation of Millard is actually a decussation of the superior colliculi, and the fibers we are referring to here are tectospinal and tectobulbar tracts. Now we come down to the next decussation, the ventral tegmental decussation. This decussation is actually referred to as decussation of rubrospinal tract. These are tracts arising from the red nucleus. These are the nuclei. So they also decussate here, and they are called the ventral tegmental decussation or tegmental decussation of Forel. At this level, the medial longitudinal fasciculus is bound to the nucleus of the oculomotor nerve, as we noted earlier in this lecture. The tegmentum at this level also contains same lemnisci. We are seeing the medial, the trigeminal, and the spinal, but at this point we can no longer see the lateral lemniscus. This is because the lateral lemniscus terminates in the nucleus of inferior colliculus. So at the lower level we see all the 4 lemnisci, but at this top level we see only 3 of them, with exception of the lateral lemniscus. We also like to look at the structural components and their functions. Superior colliculus is a reflex center for visual reflexes. Inferior colliculus provides lower auditory centers and reflexes involving auditory stimuli. You can notice that superior colliculus was connected to the lateral geniculate body that was involved with vision, and inferior colliculus is connected to medial geniculate body that is involved in auditory pathway. Now look at the red nucleus, which gives involuntary control of muscle tone and posture. Substantia nigra regulates activities of the basal nuclei. Both oculomotor and trochlear nuclei will give rise to the nerves. In the white matter, the cerebral peduncle containing number of ascending and descending fibers will provide passage to fibers of both motor and sensory tracts. We will look at blood supply of the midbrain, and this is actually through basilar artery. The main branches are 1. The posterior cerebral and superior cerebellar arteries. Let's look at this image. Here is the basilar artery, and above here is the posterior cerebral artery, and then below here is the superior cerebellar artery, and we can see branches from the posterior cerebral artery moving into the various parts of the midbrain, and also branches from the superior cerebellar artery doing the same. Other branches are posterior communicating and anterior choroidal arteries. The venous drainage of the midbrain is through great cerebral and basal veins. We will start our discussion on clinical correlates on midbrain by looking at the degeneration or destruction of substantia nigra. When this happens, it causes deficiency of dopamine in the basal ganglia, that is the corpus striatum of basal ganglia, and this will lead to clinical conditions such as Parkinsonism. In this image, this is a normal fiber where we have a normal release of dopamine, and then when we have the normal release of dopamine, we will notice normal movements. But in Parkinsonism, where there is a deficiency in the dopamine level as a result of destruction of substantia nigra, we are going to see depletion of dopamine level here, which will lead to movement disorders that will show in tremors, slow movement, and rigidity. The next clinical condition we'll look at is unilateral lesion of the superior colliculus, and this will result in relative neglect of visual stimuli and inability to track moving objects in the contralateral field of vision. As we noted earlier, one of the branches supplying the midbrain is the posterior cerebral artery. Weber's syndrome is a condition where there is a vascular lesion in the basal region of the cerebral peduncle, and this could come as a result of occlusion of a branch of the posterior cerebral artery. In this image, this is the area of the midbrain that is affected in Weber's syndrome. This lesion will involve the oculomotor nerve, as you can notice the exit of oculomotor nerve, and it will also involve the cross cerebri. There are signs and symptoms that follow Weber's syndrome. The first that will happen is lateral squint due to involvement of the third cranial nerve. Also, because the cross cerebri is involved and the corticospinal tract in the cross cerebri are affected, there will be contralateral hemiplegia. Also, we are going to have contralateral paralysis of the lower part of the face and tongue. This is because of the involvement of the corticobulbar tract also in the cross cerebri. In addition to these symptoms following Weber syndrome, there's going to be drooping of the upper eyelid. This is called ptosis. This is due to paralysis of levator palpebral superioris, which is also supplied by oculomotor nerve that's affected in this syndrome. The pupil is also dilated and fixed to light, and accommodation is lost on the site of lesion. This is because we have a Dejerine fiber running as part of the oculomotor nerve that is also affected along this area. That's also part of the area affected in this syndrome. We also consider Benedikt syndrome. This occurs due to vascular ischemia of the tegmentum of midbrain. This is the region of the Benedikt syndrome. This colored area is the area that will be affected in this syndrome. Now, it will involve the medial lemniscus, spinal lemniscus, the red nucleus, and superior cerebellar peduncle, and fibers of the oculomotor nerve. And we can notice the spread in this whole area. These are areas that will be affected in Benedikt syndrome. Benedikt syndrome is characterized by some of these following signs and symptoms. There will be ipsilateral squint and ptosis. Of course, we know this is as a result of the involvement of oculomotor nerve fiber. We also have contralateral loss of pain and temperature sensation due to involvement of trigeminal and spinal lemnisci, contralateral loss of tactile, muscle, joint and vibration sense, and this will be due to involvement of medial lemniscus, and there will be contralateral tremor and involuntary movement in the limbs due to involvement of the red nucleus and fibers of superior cerebellar peduncle entering into it. And these things are best understood if we go back to some of the functions of these areas, and then we'll appreciate what happens when we have this syndrome. Before we close, we'll take just one more clinical condition, and this is called Parinaud syndrome. This is the region that's affected during this syndrome. This results from a lesion of the superior colliculus and occurs when this area becomes compressed. And one of the things that brings about this compression is when there is a tumor of the pineal gland that is hanging above this superior colliculus. When this happens, there will be loss of upward gaze without affecting the other eye movements. We have come to the end of our lecture in Brainstem. The preceding lectures have been given in part 1, 2, and 3. We hope that this material has been very helpful, and if they are, you can share them freely, you can like our video, and the better part, be a part of Paals Anatomy family. So see you in our next video. Thank you and bye for now.